Hello and welcome to Future Focus. I'm Dr. Mark Kontos. With me today is Jim Mazzo, the Executive Chairman of Neurotech. I'd kind of like to hear your perspective. There's all these companies presenting here about new technology and what's happening in ophthalmology. And you see all of that. You get to hear all of it before we do. What are the things that you're really excited about right now in our field?
I think we now have to realize we've got a situation that's becoming a real critical problem of more patients, less doctors. You don't have the time to look at every patient anymore. The waiting room is not big enough.
Yeah.
Your staff is down. Practitioners aren't willing to put a ton of time like you used to. So what's going to be the situation is we need to have you properly diagnosed. So I call it the red, yellow, green. If a patient comes in and it's red, meaning you know exactly what the problem is, you handle it there or you refer it. If it's green, they shouldn't be in your office. They should be, you could do this telemedicine, you could talk to them, but they should not come just to get a, how you doing? It's the yellow. The one you're not 100% sure about. And we can do that with proper diagnosis and the use of AI. So I'm a 65-year-old white Italian male descent. There's a lot of other 65 white Italian male descents. Check my criteria, check the history, and make real critical decisions. So what I like about happening is companies that are information gathering. So any company that has microscopes or diagnostic, capture that information. Any company that can make you much more productive in your office, less chair time, that's where I'm spending the time. Obviously they have to have technology, don't get me wrong. But that can't be, you can't lead with the chin and think just because you have technology, you're gonna win. They've gotta have productivity, and it's gotta have less chair time for you and more patient outflow for you. If not, you're just not gonna be able to survive in today's environment.
Well, what you're saying kind of resonates because, for us, it's really all about, we need to be as efficient as we possibly can as doctors, and as surgeons, we try and be efficient in the operating room, which we've done a really great job of. But I think in the clinic space and seeing patients and examinations, there's just so much wasted time there. And companies that can develop products or services, and you mentioned AI, and I think that's going to be a huge player in this field as we go, is probably going to really make some huge changes for us in that way. It'll look different in 10 years.
And we need to put on the capital equipment side that capture of that information. So as you're seeing thousands of patients over the years, you have that data accessible to make that decision quickly. Because the cost containment pressures the United States is under in healthcare is tremendous. We can't afford to have every test anymore. You can't shotgun your approach, you must rifle it. And that's where I think we need to identify, diagnose, treat. And that's how we're gonna have to go forward with technology.